Yeah. Good morning. Oh, here we are. Tuesday, 9th of June, 2026. Well, we are health and social care in the House of Commons. Been a lot happening over the last couple of days. And hopefully this one will get started soon. Let's see what I've seen the questions they're asking. Some of them should have some, I hope, some interesting answers. We can all hope, can't we? Good morning, Diane. I hope you're well. I'm just waiting for them to start, as usually. 11:30 start. They're late again. Horrific scenes in Belfast last night. I caught up with it a little while ago, and I have heard that it has been reported that they have made an arrest. I'm not sure on the victim's condition though at this time, unfortunately. There's lots of protests going to go on in Ireland tonight. I hope he pulls through. That was it, a Somalian man had been arrested, according to Sky News, okay? Sly News, sorry. Okay, here we go. Let's get into it. We'll see you on the other side. Don't forget to hit that like button and make sure you're subscribed. Oh, thank you.
Order, order. We start with questions. Secretary of State for Health and Social Care, David Chadwick.
Question number one, please, Mr. Speaker.
Minister, well...
With permission, Mr. Speaker, I'll take questions 1 and 9 together. The Government is committed to ensuring patients can access timely, high-quality care wherever they live in the United Kingdom, while recognising ongoing challenges. We're working with the NHS and devolved governments to improve digital interoperability, streamline cross-border billing and support more joined-up care.
David Chadwick.
Thank you, Mr. Speaker. Powys has no general hospital, and therefore my constituents are dependent on access to English hospitals for the treatment and the operations they need. Yet last July, Powys Teaching Health Board made the decision to extend waiting times for Powys patients awaiting operations. And that means that many of them have now been waiting years for their operations, often in agonising pain. So will the Minister meet with me, Powys Teaching Health Board and the new Welsh Health Minister to make sure that Powys patients get the funding and treatment they need?
I thank the honourable member for his question, and of course I would be very welcome to meet with him. Decisions he knows about waiting list management in Wales are matters for the Welsh Government, but I do agree that patients in border communities should be able to access care as quickly and conveniently as possible.
John Long.
Thank you, Mr. Speaker. For my constituents in the Scottish Borders, accessing NHS treatment can sometimes be more complicated than it should be. Some residents in the Scottish Borders are registered with GP practices in Northumberland, but their medical records are not always shared properly between NHS services in England and Scotland. Now, the SNP government refuses to allow reciprocal care, so will the Minister urgently work with the Scottish Government to ensure my constituents can be properly treated as closer to home as possible?
I thank the honourable member for his question. I am aware of the concerns he's raised where NHS organisations on both sides of the border work together to improve access for patients. NHS England is working closely with NHS Scotland to improve the compatibility of patient records. I believe that they must do much more, and I'd be happy to meet with him to discuss further.
Dr. Kieran.
Number 2, Mr. Speaker.
Minister.
Thank you. We know some patients prefer not to use online services. Online tools complement rather than replace existing routes such as telephone or walk-in access. The GP contract requires online access to be available during core hours, which eases pressure on phone and reception staff as non-digital routes to access care. Under this government, patient satisfaction with GP access has risen from 61% to 75%.
Dr. Gibb.
Thank you. Mr Speaker, we'll all understand why making use of things like the NHS app and online appointments is a sensible thing and works very well for a lot of patients. But, Mr Speaker, I cannot be the only MP, maybe even something yourself you've heard from, constituents who really struggle. Maybe they don't have a smartphone, they're elderly patients. I've met many elderly patients who just simply cannot make use of those online forms. And too often, I'm afraid, there are GP practices that don't make it easy for them to make use of telephone appointments and walk-in appointments. I think it's really important for the government to make it crystal clear to all our GP providers, who I know are doing their best, that no matter how far we go with digital innovation, it should always be that our patients can access primary care through traditional routes like walk-in or telephone appointment making.
Well, I'm in violent agreement with the honourable gentleman. It's probably quite an unusual thing. We are very clear that patients should not be digitally excluded. The contract is clear that patients should always have the option of telephoning or visiting their practice in person, and all online tools must always be provided in addition to, rather than as a replacement for, other channels for accessing a GP. 11.5 million more GP appointments were delivered in the last year since April 2025.
Chris Vance.
Thank you, Mr Speaker. And can I first take this opportunity to thank the staff at Princess Alexandra Hospital in Harlow, particularly the Opal World, where elderly patients are transferred from A&E and supported to either return home or transferred to different wards. Another example of where Harlow is leading the way. How can we work together to support patients like these in Opal Ward to access primary care if they are not confident in using some of the online tools that we've previously mentioned?
Well, I thank him for that question, and once again he has done a great job of promoting Harlow, which we're all very familiar with him doing this in this House. As I said, we are improving access across the board in terms of GPs. We've got over 2,000 more since July 2024. We're launching a £102 million fund to build more clinical space in over 1,000 GP practices across England. So a lot has been achieved, but of course a lot more needs to be done.
Number 3, Mark Plank.
Secretary of State, welcome.
Thank you very much, Mr Speaker. And with permission, Mr Speaker, I'll take questions 3 and 10 together. Mr Speaker, this Labour government was elected to build an NHS fit for the future, and so as Secretary of State, I am accelerating its modernisation. But we know that health inequalities start long before people access the NHS. So our focus on prevention in the 10-year health strategy is crucial, as is the work of this government to address wider inequalities across all forms of life: housing, air quality and getting more people into work.
Muraz Mithendar, Mr Speaker, and I'd like to warmly welcome the Secretary of State to his place. Oversimplified indices of multiple deprivation scores simply do not reflect the difficulties in caring for people in rural and remote coastal areas like Cornwall. The government is committed to neighbourhood health, but funding is getting caught up in ICB management structures and not flowing to GP practices who should be delivering the care. How can the government ensure that neighbourhood funding does not get held up by the ICBs and flows to where it has the highest impact?
Well, Mr Speaker, my honourable friend is absolutely right that funding must not be held up. It must get to the front line to help patients, to help his constituents and people across the country. We are supporting ICBs, Mr Speaker, to work differently with providers to identify and meet the needs of their communities on a new population-based approach. We're also reviewing the outdated GP formula for distribution of funding to make sure for the first time in 2 decades it will accurately reflect need and make sure that deprived communities get their fair share.
Will Stott.
Thank you, Mr Speaker. I represent some of the most deprived parts of Swindon, and yet residents are having to travel across town to get access to healthcare. What is the Secretary of State doing to address this? Thank you.
Mr Speaker, I thank my honourable friend for his question, and he's right to point to the fact that the current model of care works least well for some of those experiencing the greatest disadvantage. And I'm pleased, Mr Speaker, that we have joint commissioning arrangements of over £28 million in place between the NHS and Swindon Borough Council, which will help tackle issues for those most at risk. As I mentioned in response to my honourable friend's question, we are also reviewing the funding formula for GP practices, resources, the first time in 2 decades, and that's a crucial step to making sure we have a fairer distribution of resources across the country.
Chair of the Select Committee, Layla Moran.
Thank you, Mr Speaker. The Health and Social Care Select Committee's most recent report into healthy ageing highlighted the unacceptable 20-year gap in healthy life expectancy between the most and least deprived areas of the country. It also points out that physical activity can be as, if not more effective, at treating the ailments of older life than pharmaceutical intervention. And that's why we recommend that the government targets the least active groups to narrow that gap and to embed activity into clinical practice. I welcome the Secretary of State to his place. We've yet to have our first conversation. Let's have our first meeting where we might discuss this and more, and how to embed tackling inequalities into the whole of the National Health Service.
Well, Mr. Speaker, I thank the Honourable Lady for her question and look forward to working together constructively with her in her role as Chair of the Select Committee. She's absolutely right to point to the importance of embedding prevention, healthier lifestyles in the way that we approach healthcare in this country. Although we talk a lot and passionately about the NHS, health is not just about the NHS. So many determinants of health start long before people access the NHS. And so in our 10-year health plan, there is a huge focus on tackling obesity, on tackling smoking, on making sure people have more active, healthier lifestyles, because that is the way to reduce pressure on the NHS and make sure that people across the country live healthier lives.
Alison Griffiths.
Thank you, Mr. Speaker. West Sussex County Council's Health and Adult Social Care Scrutiny Committee has concluded that the closure of Zachary Merton Hospital in Rustington constituted a significant variation in services. Given statutory requirements for consultation, promised but never delivered, when can residents expect a decision on my call-in request?
Well, I thank the Honourable Lady for raising the situation in her constituency, and for all of us as MPs, our first job is to raise matters which pertain to our constituents, and healthcare is amongst one of the most important services they receive. I'll ask my team to look further into the points she raises and get back to her on that.
Dr Caroline Johnson, Shadow Minister.
Thank you, Mr. Speaker. Does the Secretary of State agree that state-funded healthcare should be provided to all children based on clinical need and not economic or educational status?
Well, Mr. Speaker, it's an essential part of our NHS and its founding principles that the NHS is available to all on the basis of need, not their ability to pay. And that is a fundamental principle that we in this party support. I know some parties on the benches opposite are moving away from that recently, seeking to privatise provision of our health service and move to an insurance-based model. But we on this side of the House, Mr. Speaker, believe that all people, including children, must get the healthcare they need based on their need for that healthcare rather than their ability to pay.
Dr Caroline Johnson.
Thank the Secretary of State for his answer. Does he therefore share my concern at reports that some children are being turned away from state-funded healthcare because they're not attending a state school? Will he look into it and ensure that he makes provision for those children who are not attending state schools to receive the healthcare that they need?
Apologies for this. I don't. They're cocky.
Further details. I'd be happy to look into that.
The Democrat spokesperson, Heather Morgan.
Thank you very much, Mr. Speaker. The former Secretary of State recognised an appalling culture of medical misogyny and basic everyday sexism within the NHS. So it was extremely disappointing to see that the new Women's Health Strategy was inferior to the Men's Health Strategy. The Men's Health Strategy received 60% more funding for new initiatives, has a named academic network, a formal NIHR-aligned research mandate, and a commitment to publish a one-year accountability report with named responsible organisations and formal timeframes for every action, and commit specific funding to trials and pathfinders. The Women's Health Strategy, as it stands, has none of these things. It contains no specific measurable time-bound target to reduce the backlogs in endometriosis care, nor does the NHS 10-year plan include endometriosis, PCOS or fibroids in its prevention agenda. Can the Secretary of State explain why?
Well, Mr. Speaker, I thank the Honourable Lady for her question, and the renewed Women's Health Strategy was a really important achievement under the previous Secretary of State to make sure that we updated the approach of this government and reflect the differences in healthcare that women too often receive. And if I might offer a personal reflection, Mr. Speaker, since I've become Secretary of State, one of the issues that many women have raised to me is the fact that they don't feel the health service adequately listens to them and takes their pain seriously and gives them the right pathways through the health service to get to the right treatment that they need. That must change, and this government will change it.
West.
Question 4, Mr Speaker.
Minister.
This government is committed to delivering the 5-year cross-government suicide prevention strategy. We have published NHS England Staying Safe from Suicide Guidance. While progress has been made, we recognise there is more to do and will continue to drive delivery of the strategy.
Mr. West.
Thank you, Mr Speaker. The strategy said that it would reduce the suicide rate over the next 5 years, with initial reductions observed within half this time or sooner. However, we've passed the halfway point now, and these initial reductions have not been achieved, sadly. What's the government's plan to ensure that this target is achieved by the end of the strategy?
Mr Speaker, can I firstly commend my honourable friend for her tireless campaigning to improve mental health and prevent suicides. I know this is personal for her. We've made progress implementing the strategy, including launching the near real-time suspected suicide surveillance system to detect trends earlier. We've also committed £3.6 million in support for middle-aged men for areas that need it, ensuring this is co-produced with families and local partners so it is accessible. We are planning to update the strategy, which will consider the evidence, the progress so far, and where there are opportunities to go further. But I would really welcome her input into this very important work.
Joshua Reynolds.
Speaker, early intervention saves lives, yet far too often support only arrives at the point of crisis, especially for young people in our education system. So will the Minister today support our calls for a dedicated mental health professional in every primary and secondary school, as well as mental health hubs in our communities, so fewer young people reach that point of crisis?
Yes, I mean, this government has already recruited 8,500 mental health support workers. More than 10,000 schools already have a mental health support worker. There is much more to do. We've got to make sure that young people are not left on a waiting list. We know that many face crisis before they can even access care, and I'd be really keen to hear from him a bit more about the work that he is doing locally to raise this.
Jessica.
Very much, Mr Speaker. Further to the last question, my constituent Emma Webb's 16-year-old daughter Brodie tragically took her own life in 2020. Since then, Emma has worked tirelessly to raise thousands of pounds for charity, raising awareness of suicide prevention and launching Do It for Brodie, a project that aims to break down barriers. Can I invite the Minister to pay tribute to the work that Emma's doing and also say more about suicide prevention amongst young people and children?
Can I thank Marable for raising that really important question? I, of course, pay tribute to Emma. In the renewed Women's Health Strategy, we have committed to improving mental health support for women and girls. This is about helping women and girls access mental health support in ways that actually work for them. And we're promoting collaboration to improve women's knowledge and healthcare professionals' understanding of the relationships that many women and the barriers that they face. Of course, there is much more to do, and I'd be keen to work with her and hear the story from Emma and what more we can do in this space.
Thank you, Mr Speaker. In rural areas like South Devon, agricultural workers and isolated young people often face distinct acute mental health crises, yet local mental health provision is stretched to breaking point. What specific targeted support is the Department providing to rural health boards to ensure that suicide intervention services actually reach isolated rural workers who cannot easily access standard workplace mental health schemes?
I thank her for her question. I think she raises some really important challenges, and of course the Women's Mental Health Strategy will raise some of that. But there is work underway to develop a more comprehensive offer to address the critical issue that many young people transitioning to adult services equally face, and this includes the bespoke guidance in the revised Mental Health Act Code of Practice. The government is also funding early support hubs. This provides free open access mental health support for young people up to the age of 25, and under the new developmental service specification, children and young people services will no longer be required to transfer or discharge a young person on their 18th birthday where clinically appropriate.
Order.
5, please, Mr Speaker.
Minister.
Thank you. For 26-27, NHS mental health spending is forecast to reach a record £16.1 billion, representing a real terms increase compared to the previous year. This is supported by £473 million in capital funding over the next 4 years, including investment in new mental health emergency departments and community-based mental health centres. Dorset is one of the places across England to benefit from an expanded urgent and emergency mental health offer with new mental health emergency departments planned.
Lord Hatton.
Thank you, Mr. Speaker, and I thank the Minister for his answer. This summer, 2 new state-of-the-art mental health facilities are opening in Dorset, Chaddesley House in Poole and Seastone in Bournemouth, thanks to continued investment from this Labour government. However, the Forston Clinic in the west of the county also requires fresh investment to upgrade worn-out hospital buildings. So will the Minister meet with local NHS bosses, the Honourable Member for West Dorset and myself to discuss securing the investment needed to finally upgrade the Forston Clinic?
Well, my honourable friend is absolutely right. His constituents will be able to access care at the new facilities in Poole and Bournemouth, thanks to the government's investment in the new hospitals programme. But there is more to do. We are committed to addressing poor quality NHS infrastructure and ensuring facilities like Forston Clinic are safe, comfortable and capable of high quality care. That's why we're investing £30 billion over 5 years for the maintenance and repair of the NHS estate. We would of course be delighted to meet the honourable members and local NHS leaders to discuss this issue further.
Speaker, and I thank the Minister for his comments about Forston, which some of my residents will also use. Evidence suggests that half of mental health conditions are established by age 14 and 3/4 by age 24. And in Dorset, our rates of hospitalisation for self-harm is almost twice the national average in age 15 to 19. I recently met Anya, a student at Litchett School and the Deputy Member of Youth Parliament for Dorset, who has launched her Health in Mind campaign to ease young people back into school following periods off for mental or physical health issues. It's so inspiring to see the work that she's doing. But will the Minister meet with me and Anya to hear more about her campaign and see how we can make more successful reintegration for children back to school after ill health, particularly mental ill health? Yeah.
I thank the honourable lady and I pay tribute to Anya for the outstanding work that she's doing. We are providing early intervention for children's mental health and well-being by rolling out mental health support teams to every school by 2029. We're also investing £13 million to pilot enhanced training for staff so they can offer more support to young people with complex needs such as trauma, neurodivergence and disordered eating. And if the honourable lady would like to write to me with further details of Anya's work, I'm sure that we can continue that conversation.
Robin Moore.
Number 6, Mr. Speaker.
Secretary of State.
Mr. Speaker, this government's focus on shifting from hospital to community will benefit millions of people and increase access to care. This shift is underpinned by new community diagnostic centres that now deliver faster, more accessible care at 109 sites, 12 hours a day, 7 days a week. And by 2030, we will have opened 120 new neighbourhood health centres. This expansion will transform community access for those who most need it.
Robin Moore.
Thank you, Mr. Speaker. Back in 2023, the previous Conservative government signed off £3.4 million to Keighley to build a new health and wellbeing hub to improve care in the community. But we have plenty of brownfield sites, funding is secured, but we are progressing at a snail's pace with progression moving incredibly slow. We are mid-2026 and there is no planning application that has been submitted yet. So will the Secretary of State meet with me so that we can unlock this project and get it delivered?
Well, Mr. Speaker, it might not be the first project initiated under the previous government that hasn't exactly run ahead at the fastest pace possible. But I would say to him that we need to make sure that neighbourhood health provision is delivered as quickly as possible across the country. Our plans to increase neighbourhood health centres will focus on those areas with below average healthy life expectancy, making sure that rural towns and deprived areas get the help they need quickest. And part of this is the shift that I referred to in an earlier response about the shift from hospital into the community, making sure that we prevent ill health before it occurs.
Last year I campaigned with the community and local councillors to save the Crystal Dementia Centre in Stourbridge. The centre provides community support to dementia patients and their carers, employs dementia advisors and assessors and offers day services to many local people. But sadly, since saving the centre, Dudley Council has sought to close the centre still by stealth by preventing new assessments and preventing new users from joining. Does he agree this is a disgraceful way for the council to act and it goes against the government's mission to provide quality care close to home, and will he meet with me to discuss this further?
Well, I thank my honourable friend for raising that situation in her constituency, and it does sound concerning that that decision has been taken. I would urge all councils to work with their local ICBs and other parts of the NHS system to make sure that that healthcare is provided in local areas where people can access it as part of our plan to make sure that healthcare is available right across the country.
David Reid.
Question number 7, Mr. Speaker.
Secretary of State.
Mr. Speaker, too many men live too much of their lives in poor health and face barriers to accessing health services. That is why we have published England's first ever men's health strategy to get men speaking about their physical and mental health, and we're getting on with implementing it. From partnering with the Premier League to investing in the Men's Health Community Fund, we are meeting men where they are and supporting them to live longer, healthier lives.
David Reid.
Thank you, Mr. Speaker. The NHS itself says that prostate cancer often has no symptoms at first. Prostate Cancer UK says most men with early prostate cancer have no symptoms at all. Now, the government's own Transform trial exists because current detection methods are recognised as inadequate. So why does government messaging still point men towards early symptoms they are unlikely to have, while cancers that could be cured are becoming cancers that cannot?
Mr. Speaker, let me be really clear in my advice to any man who is worried about prostate cancer, whether he has symptoms or not. Go to your GP, discuss it with your GP. Testing is available when people's GP recommend it, and I would recommend no man to worry about it in silence, to sit at home and fret about what might be going on. Go to your GP and discuss it. With regards to the wider screening programme that we've agreed to do as a government, the targeted screening programme, that is based on the evidence of weighing up the benefits of screening versus the harm that it can cause. Because we know that at the moment, if you identify cancerous cells, Mr. Speaker, and have treatment, for example, by removal of the prostate, in 20% of cases that leads to permanent urinary incontinence, and in 2/3 permanent erectile dysfunction.
Steve Darling.
Number 8, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. With permission, I'll take questions 8 and 20 together. We inherited a decades-old system where patient voice was divorced from decision-makers, with over 20 organisations offering a place for patients and users to share feedback. The Health Bill will put the views of patients and users at the heart of decision-making, ensure it directly informs those responsible for commissioning locally, and we'll create a new Patient Experience Directorate in the department to ensure patient and user insight directly shapes national policy making.
Steve Darling.
Thank you, Mr. Speaker. The abolition of Healthwatch will see the NHS and the government effectively marking their own homework. Can the Minister please give some assurances how the government will ensure that the voice is heard from those with learning disabilities, complex needs and dementia?
He makes an important point about the variety of needs that local commissioners need to take account of, and that is exactly what the Health Bill will try to do, not by outsourcing that role to an outside body, but putting those views at the heart of what all commissioners to do, which includes making sure underrepresented or normally often unheard voices do have that exact voice.
Thank you very much, Mr. Speaker. When Boots decided to close 2 pharmacies in Hampton, leaving a large number of elderly and vulnerable residents without local pharmacy provision, Healthwatch Richmond played a crucial role in ensuring we got a new community pharmacy in that area. That locally led patient voice can't be replaced by officials in Whitehall or our local ICB that's about to suffer over 50% cuts in its operating budget. So will she think again if she's really serious about championing patients?
Again, she raises an interesting example of somewhere where the local commissioners have failed to provide a service or recognise when a service disappears. They can do that through using very different voices rather than outsourcing that responsibility. We have to make sure, as we go forward in this bill, that commissioners do their job properly, which includes patient voice at that very local level.
Jill Muskell.
Replacing Healthwatch will mean that ultimately patients will not have confidence in the commissioners. We've just heard one example, and I can offer many examples in York where York Healthwatch, which is phenomenal, led by Sean Balsam, has led reports which has brought about change. So I do plead with the government to review clauses 64 and 65 of the Health Bill to maintain Healthwatch. It should not be either or. It needs to be commissioners engaging with the patient voice, but also Healthwatch having that independence to advocate for patients.
I thank her for her comments and her comments about her local health watch. And there are certainly examples where this does work well in local communities, and we need to understand those. But it doesn't work well everywhere, and it does mean that local commissioners are not then empowered and indeed held accountable for their job of making sure that that voice and experience is held locally. There is also nothing to stop ICBs undertaking that role differently as they see fit in their local communities in the future, rather than dictating how they should do it through one particular body.
The Brash.
While I support the government's desire to drive out bureaucracy from the NHS and simplify systems for patients, locally, Healthwatch Hartlepool has done an outstanding job in ensuring that patients' voices are heard as systems and services are improved. So what can the Minister do to ensure that that local expertise is retained in any new system?
And I thank him for his comments. And again, it's highlighted that if that works well for his local system, there is nothing to stop, and indeed the ICB's role, how they undertake that role, has to be determined locally to make it most effective for those local circumstances, and they can undertake that role as they best see fit.
Graham Stewart.
Thank you, Mr. Speaker. People in Beverley and Holderness... Oh, number 11. Sorry, Mr. Speaker.
Thank you, Mr. Speaker. Over 85% of waiting list removals are as a result of patient care. And since the end of the pandemic, unreported removals have been below pre-pandemic levels. Record levels of elect activity are being delivered by NHS staff, enabling us to cut waiting lists and meet our interim target of 65% of patients being seen within 18 weeks, the highest performance in over 4 years.
Graham Stewart.
Speaker, and I apologise for being taken by surprise. People in Beverley and Holderness want high quality and speedy care, not massaged health waiting list numbers to suit Labour narratives. And of course, Mr. Speaker, you'll remember that the last Labour government had form on this as well, when repeatedly the NAA found that the numbers were manipulated when waiting lists were similarly put on a pedestal in that way. So can the Minister, and perhaps with the new Secretary of State by her side, how can she give reassurance to people in Beverley and Holderness that we are going to have genuinely improved health care rather than widespread manipulation and cleansing of waiting lists to suit political purposes?
Well, the last Labour government, if anyone's forgotten, left the NHS in the best state it had been. And that is not in dispute. That is not in dispute in terms of waiting list targets or indeed of patient satisfaction. He might want to re-look at that record. This point that the Conservatives seem to be intent on following up forever is an important one. 85% of the activity is as a result of direct patient care. Validation, both clinical and clerical validation, is long-standing routine practice of waiting list management. It is no different now at roughly 15%, slightly higher before the pandemic, than it has been before. So it is just not the case that there is something different going on here. What we are doing is making sure that patients, his local constituents, and I appreciate in his system there are many other local problems going on at the moment, they can be clear that people on the list are the right people on the right list for the right care in the right place by the right clinician, and that is what we're determined to do.
Thank you, Mr. Speaker. I commend the Minister for her work in reducing waiting lists for GP referral to first treatment, and they are genuinely coming down. She will be aware, however, that that statistic doesn't capture the entire picture, particularly for people who then require subsequent follow-up care. For example, women with endometriosis or women waiting for breast reconstruction following breast mastectomies. Could you say a little bit about any plans she has to capture those waiting lists?
I thank him for his question, and of course he is someone who does understand the way in which waiting lists are managed and so on. We don't have any plans to add any particular new targets to those that we have already committed to give confidence to the British public that we can fix the NHS and get those waiting lists down. But he raises an important point about how we support patients understanding where they are in the system and where their care will be provided. That is part of our commitment in the elective reform plan that we outlined last year, that patients are kept up to date about where they're being treated, why they are being referred on to perhaps a more local service, and we will continue to try and do that.
Gentleman is Dr. Luke.
Thank you, Mr. Speaker. And last month, the Health Service Journal reported that elective waiting list target was met largely
largely because a record number of patients were removed from waiting lists in March without receiving treatment. So can the Minister tell the House how many patients were removed in March, what happened to them, and whether she is satisfied they definitely didn't need treatment? Yeah.
Well, again, as I said earlier, I'm still a bit perplexed as to why the Conservatives are perpetually highlighting their inadequate management of the health service and the idea that patients are simply referred to a waiting list and then left there for a couple of years, which is what happened under their watch. It is important that patients know why they're on a waiting list and that obviously they get the best clinical care as quickly as possible. I don't have to my hand the exact figure in March. That will obviously be published as part of the normal process when we publish the waiting list targets. I can tell him that completed pathways were 5.9% higher in the 21 months from July 24, when we took office, to March 2025 than the previous 21 months. Patients are getting the right care in the right place that they deserve under this government.
Good job.
Question number 12, please, Mr. Speaker.
Mr. Speaker, it's not just the Conservatives raising this, it's Patients and the Health Service Journal. And the answer is 350,000 people. That's a city the size of Coventry, wiped off the waiting list with no treatment. And it's 100,000 more than the month before. So if there's genuinely nothing to hide, the government shouldn't worry about pushing these figures out. So will the Minister commit to a review to find out what's happened to these 350,000 patients? Or does she believe that waiting lists should be met by removing patients from the figures rather than actually treating them?
This is an established way of managing waiting lists and waiting times. We are making sure that there is adequate clerical and clinical validation of the list and that patients are treated where they need to be, closer to home and often in more local circumstances. Of course, we have committed to greater transparency than was had under the previous government. We continue to do that. Obviously, if there is something that comes through that, I'm very happy to the exact question I didn't quite follow from the honourable gentleman. We are confident in the data that is coming forward. As I said, this is standard practice. It is roughly about 15%, as it has been over many, many years.
Good charter.
Thank you, Mr. Speaker. Number 12, please.
Minister.
Thank you, Mr. Speaker. Health visitors play a vital role in supporting babies, children and families. Under the previous government, the number of health visitors fell significantly, which is why this government has taken action. The upcoming professional strategy for nursing and midwifery will set out a bold direction of travel to strengthen health visiting across England, and we have already made improvements with all post-birth health and development reviews now completed for over 80% of children nationally, the highest levels since recording began.
Thank you, Mr. Speaker. I recently gave evidence to Baroness Amos's National Maternity Inquiry, sharing the trauma my wife and I endured. And after the birth, even as she carried her own burden, she was my rock. But the NHS was not. I was invisible, no one asked about me, and I was left to carry it alone for months. So will the Minister please ensure that health visitors recognise dads and other non-birthing partners, check in on their mental health and help them access support, so that no more dads are forgotten when families need them the most?
Thank you, Mr. Speaker. And can I thank my honourable friend for being so brave and willing to share his and his wife's birth trauma and about the lack of support afterwards, not just with Baroness Amos and her review, but with the House today. I know personally how hard it is to do that, but I also know the huge difference it can make to government policy. I am happy to commit to him today that the government will absolutely look closely at all of the findings in Baroness Amos's review and with the National Maternity Task Force to translate the recommendations into action. I am also pleased to confirm that we have recently updated our National Health Visiting Guidance to include a high-impact area on family mental health, with a clear focus on supporting both mothers and fathers.
Speaker, it's not just the number of health visitors that needs improving. Women report to me they've skipped appointments due to negative experiences with health visitors, especially around breastfeeding. Will she commit to improving the training of health visitors so that women are receiving the best quality care?
Yes, I will. We are busy working on the 10-year workforce plan, and the training of all the NHS workforce, including health visitors, is a big part of that. I am in my new position as Public Health and Prevention Minister. I am particularly interested in the work of health visitors, and especially with regard to breastfeeding and supporting rates of breastfeeding. And he will be aware that the breastfeeding survey was released, the results of that was released last week, and they did show substantial improvement.
Question 13, please, Mr. Speaker.
Minister.
Thank you. This government is rebuilding England's broken NHS dentistry system. The Dental Recruitment Incentive Scheme encourages dentists to work in underserved areas. Data on the scheme's effectiveness will be published later this year. We're taking steps to increase the supply of dentists. For example, last week I was very proud to announce the first sustained expansion of dental school places since 2007. Backed by £11 million per year, a total of 50 dental school places a year have been allocated.
Mr. Smart.
Thank you, Mr. Speaker. My constituent John, who's from Bredbury, has been in touch because, like with so many others, his local dentist is going private. And for many families in my constituency, private dentistry simply isn't an affordable option. Research by the British Dental Association found that 96% of practices are not accepting new NHS patients, and a golden hello worth £20,000 over 3 years isn't adequately compensating for a contract that loses money every day. The scheme just isn't working. It's recruited 2 dentists, 2 in the whole of Greater Manchester, neither of which is in my constituency. What more can the Minister do to make sure my constituents get the dentists they need where they need them?
I thank her for that question, and she's absolutely right to raise the issue of the contract. The fundamental problem is that the units of dental activity system is a contractual system that does not work for NHS dentistry. That is why we had the absurd situation when we came into office in July 2024 that there was a £392 million underspend on NHS dentistry because dentists weren't incentivised. We're changing that. I've got the underspend down to 36 million. There's still a very long way to go, and we need to reform the long-term contract to incentivise dentists to do NHS dentistry.
Whereas, Mr. Speaker, access to NHS dentistry remains too difficult in rural and coastal communities like South East Cornwall, where residents face long travel times and limited provision. So would the Minister meet with me to discuss what next steps we can take to improve local access?
I thank her for that question, and she's absolutely right that there are areas of the country, as we know, that are known as dental deserts. We have to fix that. It comes back again to the fundamental issue about how to incentivise dentists to do NHS dentistry, regardless of where they are in the country. But there are particularly acute pressures in constituencies such as the one that she so brilliantly represents, and I'd be happy to meet her to discuss it further.
Elsa Blunden.
Question 14.
Minister.
Thank you, Mr. Speaker. We know men are less likely to seek mental health support and suicide rates are higher in men, and we are taking action to address this. Through our men's health strategy, we've launched a partnership with the Premier League to improve mental health literacy. The Suicide Prevention Support Pathfinders programme will invest up to £3.6 million in areas where middle-aged men face the greatest risk of suicide, the North West being one area with some of the highest rates.
Elsa Blunden.
Mr. Speaker, and I welcome the publication of the Men's Health Strategy, especially the measures in it designed to improve mental health outcomes. In a report that I recently sent to the ministerial team following an event that I held with local charities and mental health service users, it became really clear that the recommendations of that strategy need to be implemented quickly. What practical steps are therefore being taken to implement those measures, especially in areas like mine, where deprivation continues to really affect the health of men and boys?
I warmly welcome my honourable friend's report, and can I thank her for all her work on behalf of her constituents. Locally, NHS and council partners are supporting delivery through services like Thrive, Thinking Ahead, Talking Therapy. We also have a mental health call for evidence, which is now live until the 12th of July, seeking practical examples to tangibly improve outcomes and inform our mental health strategy. And I would be very keen to work with her on what more we can do.
Tim Farron.
Mr Speaker. The suicide rate amongst men in Cumbria is twice the national average. There are a whole range of reasons why that is so. One of them is clearly bound up in isolation and rurality. I wonder whether the Minister will be willing to meet with myself and the Farmer Network as we seek to deliver mental health answers to people struggling. Often, when you've got 25% of farmers on less than the poverty rate, when you've got people who are isolated, dealing with transition at times of enormous stress and anxiety with nowhere to turn, would she agree to meet with me in the Farmer Network so we can address this particular cause of this appalling tragedy in our county?
Yeah. Can I thank my honourable friend for raising that really important issue? And of course, we must not overlook the needs, especially with farmers, as he raised. And our men's health strategy has invested an extra £3.6 million in suicide prevention work in the most deprived parts of England, where men face the greatest risk of suicide. And the partnering work that we're doing with the Premier Leagues Together Against Suicide initiatives to meet men where they are on their term, so they don't suffer in silence. And I'd be really, I look forward to working with him and meeting with him to hear more about this.
Lewis Cocky.
Thank you, Mr Speaker. Question 15.
Thank you. Mr Speaker, the NHS Modernisation Bill will clarify and strengthen accountability in the NHS. It ends fragmented accountability that we inherited on coming into government, and the reforms will restore clear democratic accountability with the Secretary of State directly accountable to Parliament and the public, and we will enhance local autonomy, ensuring NHS organisations are good partners and deliver for their local populations.
Lewis Cocky.
Thank you, Mr Speaker. We need more local accountability in the NHS. In Broxbourne, we've seen thousands of new houses built, but when I and local Conservative councillors have pushed for new healthcare facilities to cope with the new demand, we have been refused. Can the Minister explain, under their new system, who will be accountable for that?
He highlights a situation familiar to many of us, one of the many problems that we inherited from the last government with this fragmented landscape. So I thank him for his question. And the ICB, clearly responsible for commissioning for their population to improve access to healthcare and reduce inequalities. That's absolutely a key part of their responsibility. And they will be held accountable through the outcomes framework. It's the first time ICBs will be held accountable through that process.
Alan Dolan.
Mr Speaker, Jules Fielder from Hastings was diagnosed with stage 4 terminal lung cancer after doctors missed her symptoms, mistaking them for tennis elbow. As a non-smoking young woman, she was not meeting the stereotype of what lung cancer patients often present with, but she was determined to channel her own tragedy into change. She campaigned for better, earlier awareness among clinicians and members of the public of symptoms, and she took this message to everyone she could. Together, we convinced Boots to roll out on-shelf awareness labels in the cold and flu medicine section to raise better awareness. And sadly, Jules passed away last month. Will the Minister join me in paying tribute to all of Jules's campaigning and commit to continuing her vision in the Department of Health of making sure we use every possible avenue to raise better awareness and catch cancer earlier?
Well, I thank her for raising that example of tremendous public service in the face of the adversity, and obviously we are sorry to hear of Jules passing, and our thoughts are with her friends and family. But she does highlight the way in which people can access and determine outcomes, and it is the responsibility of those working in local health services, particularly in this case the ICB, to have that way of involving people and actually using their experience to drive change that we want to see as part of this health bill.
Question number 1. Sarah State.
Mr Speaker, the NHS matters deeply to me, to every one of my colleagues and to people right across the country, and that is why we are not wasting a second in driving delivery and pushing forward with extending prostate cancer screening to protect men at most risk, appointing a new national maternity advisor to give every woman and baby a safe birth, accepting the Mann Review recommendations to rid the NHS of anti-Semitism and all forms of racism, and of course, with my honourable friend, the member for Bristol South, taking the NHS Modernisation Bill through its second reading last week. As Secretary of State, I am determined to accelerate modernisation and build an NHS that is fit for the future.
Thank you, Mr Speaker. Following power outages at Eastbourne District General Hospital that left operations and births suspended, hospital bosses submitted a strategic bid of over £10 million to the Estate Safety Fund to urgently fix this, which was rejected. So how does the Secretary of State expect our hospital to provide consistent and safe care to patients without the power going out?
Mr Speaker, I'm aware of the issues at Eastbourne District General Hospital, and patients, staff and visitors deserve better than power cuts and electrical failures. But that is why this government has set out a credible and deliverable plan to deliver the new hospitals programme. And I would gently remind the honourable gentleman, Mr Speaker, and his constituents that many of the problems the NHS estate faces today stem from the NHS being starved of £37 billion of capital investment in the 2010s when the Lib Dems were in government.
Mr Speaker, one of the biggest barriers to accessing community healthcare in Bracknell Forest is when constituents are told they aren't able to get routine diagnostic procedures done at their local GP or health centre and instead have to travel. One constituent with cancer was told he had to go to Guildford for a simple blood test. How will the introduction of a single patient record help break down some of these barriers?
I thank him for this question. And the single patient record gives clinicians that timely access to a single trusted record so that decisions can be made more efficiently, avoiding duplication, and people can spend more time with patients. And the system, which makes all of a patient's information accessible in a single place, will allow the sharing of patient data between different settings, as he outlines, and allow services to have more flexibility where services are made available.
Secretary of State Stuart Andrew.
Can I begin by welcoming the Secretary of State and the Honourable Lady to their places? Mr Speaker, the Secretary of State was in the Treasury when it imposed VAT on compassionate access medicine programmes. These are programmes which, for some patients, especially children with cancer, provide a vital last chance to access treatment. The policy has already led to the closure of one scheme. Will he now commit to abolishing this tax before any more follow suit?
Well, Mr Speaker, one thing I learnt when I was in the Treasury is that decisions about tax are taken by the Chancellor at fiscal events. So I'm certainly not, in my new role, going to start taking decisions about taxation at the dispatch box today. But the broader point here, Mr Speaker, is how important it is to make sure we have the medicines that we need for the future. And that is why this government is investing so much in research, development and innovation to make sure we have those drugs that we need, we have the medicines we need to make sure we have the healthiest possible population in the future.
This needs decisive action now. These drugs are absolutely critical to some children. This cancer drugs tax has already closed one scheme, and companies are making real-time decisions now about whether to continue programmes in the United Kingdom. He must urgently get Treasury to permanently exempt compassionate medicines so patients in most need can get the vital drugs, because in some cases it is simply their only hope.
Mr Speaker, I've explained the position about decisions in relation to tax, but more broadly, Mr Speaker, it is critical that we have the medicines of the future that we need. And one of my very first visits as Secretary of State for Health, Mr Speaker, was to visit a company who are using AI to determine new opportunities for medicines and drugs to tackle cancers and some of the other illnesses that people face. Making sure that we're investing in businesses, British businesses, to drive that innovation is crucial not just to the future health of our country, but also to economic growth.
Murray Glendon.
Mr Speaker, at the age of 6, Eric Slake was diagnosed with metachromatic leukodystrophy. MLD is treatable if diagnosed early. His parents, Tracy and Luke, are campaigning for newborn screening for the disease. In its last review of the condition, the National Screening Committee did not recommend screening, but outlined it as gathering more evidence. Will the Minister look at ways this process can be expedited?
Can I thank my honourable friend for raising this very important matter, and my sympathy is with the Lake family, and I can be aware of this matter, having met with the member for Upper Bann and her constituents on this issue last week in a very moving meeting. I can also assure my friend that the department is working with partners to see whether it is possible to set up a multi-condition evaluation so that not only MLD but other rare conditions can be assessed alongside the existing screening programmes.
Liberal Democrat spokesperson.
Very much, Mr Speaker. A damning report by the Royal College of Emergency Medicine has estimated that there were more than 15,800 deaths associated with long waits in emergency departments in 2025, a figure that I think we would all agree is an outrage. But but the government still hasn't published reliable data on long waits and corridor care, despite promising to do so by the end of May. So will the Minister tell the House what the government is trying to hide, and will they adopt Liberal Democrat calls to end corridor care within a year by freeing up beds throughout hospitals and in social care to end the blight of excess deaths in overcrowded A&E departments?
Yeah. Mr. Speaker, let me be clear that corridor care is unacceptable, undignified, and we are committed to eradicating it. Mr. Speaker, we have begun by getting specialist teams to go into the worst offending trusts to make sure we are getting rid of corridor care in those places. The NHS now has a national definition of corridor care for the first time ever. We will publish data on that shortly because I believe, Mr. Speaker, that the first step in getting a grip of the problem is to be open and transparent about its scale.
Nadia Witt.
Mr. Speaker, we all know that social care is in crisis, with huge staff shortages, unmet needs and councils' finances being pushed to the brink. So it's disappointing that the King's speech didn't contain anything on social care. With the full Casey review not expected until 2028 and implementation estimated to take up to 2036, what steps is the Minister taking now to alleviate pressures in the system? And will the government expedite social care reforms so we can meet our manifesto commitment on a national care service?
Yeah. I thank my honourable friend for that question. I pay tribute to her in terms of the work that she did formerly as a care worker. This government inherited a social care system in desperate need of reform, and we are taking action, including providing over £4.6 billion of extra funding for adult social care by 28-29 and developing the first ever fair pay agreement for care workers. Baroness Casey will submit her first report this year with recommendations on the further action we should take to move towards a national care service.
Mr. Speaker, despite rising nationally, the number accessing NHS dentists in South Gloucestershire is falling, with less than a third of adults and half of children having been seen by an NHS dentist in the last 2 years. With no NHS dentists taking on patients and more going private, how will the government reverse this decline?
I thank her for that question. As I said to her honourable friend earlier, the fundamental long-term reform of the contract is vital to incentivise dentists to do NHS dentistry. But I am also very pleased by the fact that we have really put downward pressure on the underspend. And as a result of that, we're on track to deliver more than 2.5 million extra dental treatments than in the same period before the general election.
Thank you, Mr. Speaker. I recently held a health roundtable in Purbeck, and here volunteers from Parkinson's UK made clear that more needs to be done for all those living with the illness, and so they receive the robust support that they need. There was particular concern that a shift away from routine checkups could mean that many do not regularly see an experienced practitioner. Will the Minister work with me to ensure that the voices of people living with Parkinson's are listened to and their concerns are acted upon when any changes are made to the care that they receive?
People with Parkinson's disease should receive support tailored to their individual needs as symptoms progress. As symptoms and progression vary. The NHS provides specialist multidisciplinary NHS care informed by NICE guidance and improvement programmes such as Getting It Right First Time. People with Parkinson's will benefit from our wider work to strengthen community services, reducing waiting times and improve coordinated person-centred care closer to home. So I can assure the Honourable Gentleman that the Department will continue to meet regularly with Parkinson's UK to ensure their voices are heard.
Byfleet in my constituency of Woking lost its doctor's surgery in 2005, leaving residents having to struggle via the A245 to access basic health facilities that is set to get busier due to a likely housing development. Will the Minister agree to meet with me to ensure we can bring health facilities back to Byfleet again?
Yeah. Well, I thank him for that question. We have got the £102 million utilisation and modernisation fund to enable more GP primary care estate. So that's an important point. Of course, we're also committed to delivering 120 more neighbourhood health centres by the end of this Parliament. So I hope that his ICB has put in an expression of interest for our neighbourhood health centre scheme, and I'd of course be prepared to discuss that with him further.
Debbie Abrahams.
Thank you, Mr. Speaker. There's overwhelming evidence. There's overwhelming evidence that market
I don't know why
There's
they keep
overwhelming
fucking this up.
that marginalised health systems such as the NHS can't actually increase health inequalities. So will the Health Secretary consider amendments to his health bill which will tackle the rising inequalities in existing health policies, including allowing local health and NHS organisations to determine if they need additional private sector capacity?
Well, I thank my honourable friend for that, and I commend her experience in this area. We don't have plans to, particularly, she tempts me to look at amendments in that space at the moment. The changes that we make to NHS England place that responsibility firmly at the Secretary of State's doors on health inequalities in all our policies. I'm very happy to talk to her about other ideas that she has around that. The bill transforms that responsibility onto the Secretary of State, so we have no plans to make any changes in that area.
Alison Griffiths.
People in West Sussex are unable to access an NHS dentist, and many constituents in Bognor Regis and Littlehampton tell me they have been unable to secure an appointment for years. So what specific steps is the Secretary of State taking to increase NHS dental capacity in coastal communities, and when does he expect patients to see a measurable improvement?
Well, I thank her for that question. I've said to honourable members across the House today, there is the fundamental challenge around the dental contract. The units of dental activity doesn't work as a way of incentivising dentists to do NHS dentistry. So that fundamentally has to be fixed. But I am also very proud of the fact that thanks to the measures we've put in place, 2.5 million additional courses of treatment have been delivered compared to the same period before the general election.
Fairness.
Last year I had the opportunity to witness the TAVI procedure. This is a really groundbreaking procedure for people who require valve changes. I saw this, it was quite incredible, and I would recommend all of you go and see this procedure over in St Thomas's. The patient was 82, had been bedbound for weeks, but after that 20-minute surgery they were fit enough to be discharged later that same day and look after themselves. This has a massive impact, not just on the patient's life, but also for our NHS and the wider economy, as illustrated by Heart Valve Policy's Optimal Pathway report. What steps is the department taking to not just on the patient, so to ensure NHS systems identify and treat?
I am aware of my honourable friend's significant work in this policy area, and she is absolutely right about the huge potential of TAVIs. Rise in national TAVI activity and improved getting it right first time pathways are part of our approach to reduce health inequalities and supporting more timely, equitable care. And through this work, the Government is committed to strengthening consistency in the diagnosis and treatment of heart valve disease, building on progress already made.
Phil Pinkerton.
Thank you, Mr Speaker. The relocation of Frimley Park Hospital in my constituency is a £1.8 billion project, but none of the costs of the essential infrastructure to enable this new site to go ahead have been costed or budgeted for. The chief executives of the hospital simply have said that those costs will have to come from the new hospital programme contingency fund. Does the Secretary of State agree with me that that is no way to start a project of such size, scale and significance, and would he meet with me to address those concerns?
Mr Speaker, the honourable gentleman is persistent in raising this. He's raised this with me in the lunch queue as well. This is clearly an issue which I know matters to him and to honourable friends on my side of the House as well. But I think we need to
just say to the honourable member, when he's answering the question not to meant to walk in front, please show respect to each other. Secretary of State.
But, Mr Speaker, the honourable gentleman can rest assured that this government is focused on the new hospitals programme, which is now credible and deliverable after what we inherited from the previous government, and we will get those hospitals in place.
Christine Sullivan.
Thank you, Mr Speaker. On Thursday, I will chair the Endometriosis APPG's first evidence session of our inquiry into endometriosis in the workplace, and we will look at the experiences of women living with the condition, the lack of timely treatment for chronic symptoms, and how this impacts them in the workplace. Will the Secretary of State commit to reviewing our recommendations once published later this year?
I commend the Honourable Lady for her great work and that of the APPG on highlighting the importance of endometriosis and the impact. We would be delighted to continue our close engagement with you and the APPG on this topic. We will consider the APPG's findings carefully when they are published as part of our ongoing work to improve diagnosis, treatment and support for women with endometriosis.
Helen Maguire.
Speaker, Epsom and St Helier hospitals need urgent funding now, not just patchwork repairs. In 2024, 600 operations were cancelled due to ventilation issues, and this situation is only going to get worse. So will the Minister address the backlog of hospital repairs now to ensure patients and staff have safe and modern facilities in Epsom and St Helier hospitals?
Mr Speaker, under this government, we have increased capital investment in our NHS estates, including hospitals, because, frankly, under the previous government, that was sorely lacking and stored up problems that we are now experiencing today. There is a huge amount that we need to invest in to make sure our NHS is fit for the future, but we also need to reform the service, which is why modernising the NHS is a key priority for me and this government.
Chris Webb.
Thank you, Mr Speaker. At the beginning of the year, Blackpool had the worst 12-hour A&E waiting times in the country, but thanks to the tireless work of local NHS staff, that's been reduced by 43%. However, we face some of the biggest challenges in the country with health inequalities, deprivation and the 21 million visitors that come every year. So would the Secretary of State agree to meet with me and our CEO of the hospital to talk about what support we can get to bring these numbers down so that residents in Blackpool can get the care they need?
I thank my honourable friend. I'm very happy to work with him to tackle health inequalities in his area. As he rightly highlights, our investment in the NHS and in the wider health of the nation is specifically about tackling health inequalities such as those that he raises and which affect the life chances of his constituents.
Joe Robertson.
Thank you, Mr Speaker. The crisis in social care is particularly bad in my constituency on the Isle of Wight, partly because of our unique geography, but also because the government has reduced funding to our local authority. And our council is now looking at discharging patients to the mainland away from family and friends, which is completely unacceptable. Will the government recognise our unique challenges as an English island and help provide a social care solution which recognises those challenges that we face?
I thank him, and we have discussed this issue, and I absolutely recognise the need to ensure that social care is provided in the most convenient way that is possible to his constituents and as close as possible to home. Obviously, we are fixing a broken system, but we have delivered £4.6 billion more of funding. We're delivering the Fair Pay Agreement, and we're working hard to ensure that we get adult social care back on its feet and fit for the future.
Justin Mathers.
My constituents were delighted to see the opening of the Great Sutton Medical Centre, but it has brought into sharp focus the need for an urgent upgrade of GP practices in Ellesmere Port Town Centre. I've submitted an expression of interest for the Neighbourhood Centre programme. I wonder if the Minister would agree to meet with me to discuss that further.
Well, I thank him for that question. I'm delighted that he submitted the expression of interest. We're now assessing proposals against criteria, including fit with our national neighbourhood health strategy, sound estates planning, deliverability, sustainability and critically local need, and we'll be prioritising areas where there is low life expectancy, higher deprivation. So I'd be delighted to meet with him to talk about his expression of interest and about our programme for revolutionising care in our country through the shift from hospital to community.
Thank you, Mr Speaker. Unpaid carers play an absolutely crucial role in supporting so many people who need to draw on social care, thereby supporting our health service and our formal social care system. But they tell me they're under immense strain. They need more support. And they are, of course, more likely to be women and more likely to be older. Does the Minister recognise the urgent need for more respite care for unpaid carers? And will he take action to provide it now, not waiting a few years for the Casey Commission?
I thank her for that. She's absolutely right that unpaid carers are the lifeblood of our care system, and we pay tribute to them for the compassion that they show. I was very pleased that yesterday I accompanied the Minister from the DBT to launch the new Paid Carers Leave consultation document. I'm also very pleased to chair the cross-ministerial group that is going to produce an action plan for unpaid carers, addressing exactly the issue she mentioned about respite care.
Jen Craft.
Mr
Mr Speaker, last week the Supreme Court judgment that overturned Cheshire West, the previous judgment on the Mental Capacity Act, has thrown the sector who care for people with learning disabilities and or autism into what they have called chaos. There is significant concern that without further clarification as to whether someone can consent to deprivation of liberty who does not have mental capacity will lead to putting vulnerable people at significant risk. Will the Secretary of State listen to calls for...
Sorry, I've got to get through. I've other members again. You've got to shorten your questions to help me. Secretary.
Mr Speaker, I can reassure my honourable friend that the Government respects the Supreme Court decision. We are considering it very carefully and we will set out updated guidance shortly.
Paul Holmes.
Thank you, Mr Speaker. Waiting times for cataract operations in my Hamble Valley constituency are rising hugely because the local ICB and its AI system have stopped offering all providers it advertises and have scrapped their contract with Specsavers, meaning only GPs can diagnose the problem. Will the Minister have a look at the local problem and intervene so that we have the widest and best possible providers to reduce those waiting lists?
He's absolutely right that getting the link between high street optometrists and secondary care working more effectively is vital. That's why I was very pleased to announce the £20 million e-referral investment earlier this week. We're also working on single point of access to get that digital interface working far more effectively, and he's right that we should be focusing on that more, and there's a lot more to do.
Adam Thompson.
Thank you, Mr Speaker. I want to raise eating disorders in relation to extreme exercise using app-based fitness classes, particularly people with very low BMI doing ultra-high-intensity exercise for hours every day, and how these apps can become addictive. When I wrote to one brand asking about implementing access limitation tools in their app, they were dismissive. Will the Secretary of State then consider reviewing whether such tools could be mandated to support those with eating disorders?
Well, Mr Speaker, I thank my honourable friend for raising this issue because it's an important angle on a problem I think we're all aware of, but facing a slightly different context given some of the modern features which are available on devices in our pockets. So I thank him for raising that. I'll look into it further and pick up with him in due course.
Seamus Logan.
Mr Speaker, many members in this place will be all too familiar with the trauma of a miscarriage. For some, this tragedy occurs more than once. Scotland is the first nation in the UK to implement a miscarriage patient charter based on the so-called Tommy's graded model of miscarriage care. Could the new Secretary of State, and I welcome to his place, could he outline whether the Westminster Government are considering replicating that system here in the rest of the UK?
Well, I thank the honourable gentleman for raising an incredibly sensitive and important issue in his question. We want to make sure that as a government, through the NHS, we're supporting women who suffer miscarriages and their families. We will make sure that we have the right provision in place to support them, and that the NHS and the wider health system is there for them when they need that help.
Sorry, Kumar.
Thank you, Mr Speaker. Dudley has high levels of deprivation and health inequalities. That's why I'm campaigning to bring healthcare on Dudley Town High Street. Can the Minister meet with me to discuss how we can leverage the 10-year plan to reduce these health inequalities in Dudley? And does he agree that we need a healthcare hub?
Well, I would definitely agree that my honourable friend is a formidable champion for her constituency, and she's absolutely right to raise the importance of making sure healthcare is easily accessible in places like high streets where people can access it easily. I'm very keen to make sure that the Neighbourhood Health Centres programme, 250 of which we've announced, 120 by 2030, are delivered as quickly as possible, and that's part of our plan to make sure that healthcare gets right into every local neighbourhood and community, and I look forward to discussing that further with my honourable friend in the future.
Sir Desmond Swain.
May I have a meeting to discuss my Parents, Carers and Babies Bill, which affords support to the Best Start Family Hubs and Healthy Babies programme?
I thank the honourable gentleman for that question. And we know that the earliest stages of a child's life are critical for their development, and the Government is committed to supporting families to give babies the best start in life, and we are investing over £900 million in Best Start family hubs and healthy babies to create an integrated, accessible system of support for families. I particularly look forward to considering the merits of the Right Honourable Member's Private Members Bill that he presents to Parliament, and I would indeed look forward to meeting with him to discuss that further.
Dr Rupert.
There's 500,000 celiac sufferers in the UK, but there's little understanding of the condition that's massively underdiagnosed. So can I invite everyone here, even you, Mr Speaker, to the drop-in that I'm doing on Tuesday the 16th with the campaign? And in particular, can they have a follow-up meeting with my honourable friend, the Minister, the member for Gateshead and Washington, as she has been a long-standing advocate and gets it?
Well, I thank my honourable friend and neighbour for her question today, and it's very welcome that she's raised this matter in the Chamber, drawing attention to so many members on both sides of the House. I don't want to speak on behalf of my honourable friend, but I'm getting a nod from my friend, the Minister. We should be happy to pick this up with you in future.
That completes questions. We've got statements, haven't we? We've got statements. Yeah, these points of order come after statements.
Thank you.
Take care.
Okay, guys, I think that is enough for today. All right. Don't forget, we'll be back. The link is there pinned in the chat for tomorrow's Prime Minister's questions. And Friday, I've got to do an event yet. We have Keir Starmer, okay? Sorry, yeah. Sadiq Khan. God, my head's all over the place at the moment. Sorry, apologies for that. So tomorrow, Keir Starmer's Prime Minister's question time, 11:30 a.m, okay? Wake up early on Friday because it's Sadiq Khan, Mayor of London, yeah, questions. That's at about 10:15 on Friday. It's a change of schedule for them, all right? I'll let you all catch up in the chat, hopefully. Thank you, UTK. Cheeky, thanks, Jojo. Andrea, thank you so much for that donation. That is much appreciated, love. And, yeah, I'm going to go on holiday now. I'm going to go on my daily holiday. I'm going to walk up to the co-op and maybe get a little bit of shopping and walk back. That's the only holiday I get. Oh, dear. Right. Thank you, everyone. Keep an eye out as well, please, everyone, for the Irish streamers. Oh, I can't remember his name. There's one of them, something Grandad or something like that. Have a look for the Irish streamers tonight, please. Show your support for them. Give them a like, give them a subscribe. I'm sure you'll see it all. Keep an eye out from around 5 p.m. If you're not following me on X, then the link is coming up in the chat now. I will sort of share it out if I find anything, stuff that I can't say on here, I will put on there as well. All right. Once again, thank you very much, everyone. Sorry if I miss anyone. I think I've got everyone. We'll see you all tomorrow morning. We can have a right laugh. Hopefully again. Right. Take care, all, and have a good afternoon. Ireland from 5:30 p.m. Yep, that's it. If you're not following me on X, I'll try and share some streams. All right. So, all right. Have a great day. Stay safe. Catch you all soon. All right.